You're feeling awful. You're tired, sweaty, and chills. You decide to check your temperature and your thermometer says 99.5 degrees Fahrenheit. You Google, is that a fever? Should I go to the urgent care? Ultimately, you decide to go see a doctor and the doctor says, you're fine. It's not really a fever. You feel dismissed, but you know that something is not right. So is 99.5 degrees Fahrenheit something to worry about? I'm Dr. Udayapan, and I help patients with complex conditions. In this video, we'll talk about what a fever really is, how medications can mask a fever, and how to decide when to take actions. By the end, you'll be able to speak your doctor's language and you'll stop second guessing your symptoms. So what is a fever? Well, in order to understand what a fever is, we have to understand what is the normal body temperature. You might have heard of the number 98.6 degrees Fahrenheit. This actually came from a German scientist in the 1800s that had done millions of recordings on his patients and had found that the average human body temperature was 98.6. But newer studies show us that the average is probably lower at 97.5 degrees Fahrenheit. Why is this? It's probably because there's less infection and inflammation today than there was 100, 150 years ago. So what do doctors consider to be a fever then if the average is typically 97.5 degrees Fahrenheit? Most doctors would say that a fever is 100.4 degrees Fahrenheit or 38 degrees Celsius. Some doctors are a little bit more stringent and they use 101 degrees Fahrenheit or 38.3 degrees Celsius. But really, this number is arbitrary, and I think that most doctors can agree on that. If someone has a temperature of 100.3, does that mean they're not sick and that they don't have a fever? Probably not. I think that there was a great post on X by a physician who had shown a spectrum of black to white, and he said, point out where gray starts, and I'll tell you exactly when a fever starts. I think his idea that the number 100.4 is arbitrary is pretty accurate there. But to make matters even more complicated, most people think that a temperature is constant throughout the day. That's absolutely not the case. Our temperature actually starts low in the morning and then climbs as the day goes on and then decreases again before we go to sleep. And that variation could be about an entire degree. We also know that as people get older, the body temperature decreases and the ability to mount a fever also decreases as well. In women who are having periods, we know that the 2 weeks prior to ovulation, the temperature is lower. And when ovulation occurs, there's a surge in the hormone called progesterone that will increase body temperature. In fact, many women use this data to monitor their fertility. When that temperature increases suddenly, that's when they know that they're ovulating. At this point, you're probably wondering, what is the best way to measure my temperature? I've seen people measure temperature in different ways, whether that's in the mouth or under the armpits or on the forehead. During COVID, you probably saw a lot of the non-contact infrared thermometers, which are similar to barcode scanners on the forehead. What is the best way? Probably the most accurate measurement of core body temperature is a rectal thermometer. We do this a lot in babies, but for obvious reasons, it's not as feasible in adults. Then the next best bet is probably the oral thermometer. It's probably still a half a degree to 1 degree Fahrenheit off from the actual core body temperature, but it tends to be a little bit more accurate than the other measurements, like on the temple or in the ear or under the underarms. One key thing that a lot of people overlook, including a lot of doctors, is the effects that medication can have on temperature. Some medications can actually mask a fever. These are medications that you might find over the counter that you could purchase, like Tylenol or Aleve, Motrin, naproxen. These are all medications that can mask a fever. And medications that people are on for diseases like psoriasis or Crohn's disease, even those injection medications, can also prevent or mask a fever. And you have to be aware of this. The common situation that I see is that a patient takes Tylenol because they're having muscle aches or joint aches, and they never develop a fever because that medication is masking it. So let's go back to that original scenario. Let's say that you measure your temperature at 99.5 degrees Fahrenheit. Should you be worried? Again, it depends, but if you're taking an oral temperature, you're older than 60, and you're taking medications like Tylenol or naproxen, it is very possible that you're masking a fever. Here's a quick checklist that you can use. If your fever is extremely high, like over 104 degrees Fahrenheit, or if you have a severe symptom accompanying the fever, like one joint that is very swollen and painful, or you're confused and having neck pain, or you're having another symptom like severe shortness of breath, then yes, that is when to be concerned and to seek help sooner. So let's go back to the initial scenario that I posed. Let's say that you measure a temperature of 99.5. You go to the doctor, but they're not too worried about it. They dismiss you. Well, what do? What is going on? It is definitely possible that your doctor has overlooked the fact that you are taking some sort of medication to suppress the fever. And in those situations, it's always okay to gently remind them that, hey, I'm feeling flushed and shaky. I'm taking Tylenol and I know that could suppress a fever. What do you think? The other possibility is that the doctor accepts and understands that you have a true fever, but they're not worried about it because they think that this will be short-lived or that this is resolving, or within the context of your other information like your blood work, that they're just not worried about it. And this happens a lot when doctors don't have the time to completely explain their thinking because the appointment is rushed or there's a lack of time. There is one situation in which you should push back if you feel dismissed, and that is if you've been feeling crummy for weeks or even months on end and you've been having fevers. This is a time to break out the spreadsheet. Take your temperature at various points throughout the day, especially if you're shaking or if you have chills, and plot or graph the points in a spreadsheet, like using Excel, or even have AI do this, and take that graph with you in your next visit. The reason being is that sometimes fevers could be caused by cancers or autoimmune conditions and rare infections. And having that data can be very helpful in getting to the bottom of what is going on. So I want you to reframe how you think about a fever, because I want you to be confident the next time you have a fever in terms of what to do and how to talk to your doctor. The number technically is 100.4 degrees Fahrenheit, but certainly if your temperature is lower than that, that doesn't mean that nothing is wrong with you. For example, if you're taking medications like Tylenol or naproxen or Aleve or ibuprofen, Motrin, those can all suppress a fever. If you're older, like older than 60, it could be harder for you to have a fever. Your temperature can vary throughout the day. And the way that you measure your temperature, like for example, an oral thermometer, is probably off by half a degree or one whole degree. So when should you seek help sooner? If your temperature is very high, like greater than 104 degrees Fahrenheit, or if you're having specific severe symptoms in addition to the fever, like neck pain or confusion, or one joint that is swollen or painful, or if you're having trouble breathing, those would be the times to go seek help. You've been feeling crummy for weeks or even months on end. This is definitely the time to measure your temperature and make a record of it. If your doctor shrugs off your symptoms, show them your data. You will be speaking their language. Let me know if you found this helpful in the comments below, and tell me what other topics you want to talk about that are frustrating or confusing in healthcare.